Manifestations of bipolar disorder range from mild to severe, but all patients experience periods of exaltation and depression, and each has its own symptoms. During manic periods, patients are extremely active, sleep less, and sometimes make risky decisions. The depressed mood makes them cry, stay in bed too long, and sometimes think of suicide. This is when patients need someone to call them, says Peter Hageland, who suffers from the disorder.
If you feel depressed, it can be really tricky and hard to tell people I need help.
Danish company Monsenso created a smartphone app that can analyze the owner's moods and behavior and alert therapists and family members. One of the bipolar patients testing the app, Mads Trier Blom, says when he was feeling tense, a therapist monitoring his condition remotely immediately called to ask how he was doing.
This measuring back to a clinician, and the clinician is able to call you back when she sees something which makes her alert, is very special for Monsanto as far as I know.
In addition to registering the patient's behavior and the interactions with others that may influence their mental health, the app also requires some self-assessment by the patient. All data is compared with the patient's account at the health provider's office. Swedish psychiatrist Christopher Sodersten is using the app with his patients.
This type of sensor data can, in combination with self-assessments, provide a hint regarding whether they match up or if there is a discrepancy.
Bipolar patients who tested the app say early registration of their mood swings is helping them learn to cope with the symptoms when they appear. George Putic, VOA News.